just focus upon the nerve supply of the upper limb. That is basically the brachial plexus. If you remember, there was some enlargement in the spinal cord. If you remember, giving 5 root values to the brachial plexus, and somehow all the 5 root values of brachial plexus will come to the radial nerve. You remember what are the 5 root values of brachial plexus given by cervical enlargement in the spinal cord? Because all the 5 will come to the radial nerve. I told you it is starting with 5. Which 5? The C5, and after that C6, 7, 8 and T1. Okay, so that is the answer to the question. Yes. So you mean to say radial nerve has all the 5 root values? Yes, it is. This is the discussion we were talking about. We said spinal cord has an enlargement. Where? In the cervical region, and that cervical region is giving us the brachial plexus, which is having 5 root values and starting with number 5. So you will see that it is C5, 6, 7, 8 and T1. Now these 5 root values, as you are talking about, there will be anterior primary ramus of the 5 root values. What is that? Anterior primary ramus of the C5, 6, 7, 8 root, and they are in the neck region forming the 3 trunks. And what are the 3 trunks in the neck region? Remember, roots and trunks are in the neck region. So which trunks? There is the upper trunk, let us see. And there's an upper trunk, and then there is a middle trunk, and then there is a lower trunk. So you're telling that there is upper trunk and the middle trunk and the lower trunk where? In the neck region. So roots and trunks are in the neck region. Then where are the divisions? Divisions pass behind the clavicle bone. Divisions will pass behind the clavicle bone, and the cords are in the axilla. So if you say cords are in the axilla, how many cords are there? You see, what happens is upper trunk is giving the anterior division, and it is also giving the posterior division. Each trunk will give anterior and posterior division. So this is upper trunk. Yes, this is upper trunk of the brachial plexus, which is in the neck region and giving the anterior division, posterior division. Behind the clavicle they pass. So the middle trunk will also have the same thing. Yes, you see, this is the middle trunk giving you anterior division and the posterior division. So similarly the lower trunk, yes, it will also give you the anterior division and the posterior division. So there are 6 divisions, 3 anterior, 3 posterior behind the clavicle. Yes. Now we want to talk about the cords in the axilla. So when you are talking about the cords in the axilla, what about them? You will find that there are 3 cords of brachial plexus in the axilla. And who are they? You will notice that there is the lateral cord of brachial plexus, and there is a posterior cord of brachial plexus, and there is the medial cord of brachial plexus. So there are 3 cords of brachial plexus in the axilla. How they are formed? You will see that there is the anterior division of the upper trunk and the middle trunk joining to form the lateral cord. So the anterior division of the upper trunk and middle trunk will join to form the lateral cord of brachial plexus. Yes. And what are the posterior divisions for doing? If you're talking about the posterior divisions, you will see the posterior division of the upper trunk or maybe middle trunk or the lower trunk, they join to form the posterior cord of the brachial plexus. So posterior division, posterior cord? Yes, actually, posterior division of the 3 trunks will join to form posterior cord of brachial plexus. And what about the anterior division of the lower trunk? If you say what is left is anterior division of the lower trunk, then it will continue as the medial cord of the brachial plexus. That will form the medial cord of the brachial plexus. So there are 3 cords of brachial plexus, which is lateral cord and the posterior cord and the medial cord. Now how they are formed, we will discuss it again, but at this moment you have to remember, this is just an overview we are taking here. Details will come later. The lateral cord of brachial plexus will continue as the musculocutaneous nerve. So as you're telling, lateral cord of brachial plexus will continue as musculocutaneous nerve? Yes. And as you see, the posterior division of the three trunks will join to form the posterior cord of the brachial plexus will form the posterior compartment nerve, which is called as the radial nerve. So radial nerve is continuation of the posterior cord of brachial plexus. And what of the medial cord? Medial cord will continue as the medial nerve, which is ulnar nerve. So medial cord of the brachial plexus will continue as the medial nerve, which is the ulnar nerve. And what about the median nerve, which is in the midline? If you say median nerve, which is in the midline, then you will find, regarding the median nerve, you will see that it is the lateral cord and also the medial cord. So it is actually the lateral cord as well as the medial cord. This is the lateral, this is the medial. So the lateral cord is contributing as well as medial cord is contributing towards the median nerve in the midline. So median nerve is contributed by not only lateral cord of brachial plexus but also medial cord of brachial plexus. Yes, that is the point. So now you got median nerve in the midline, and you have also got the ulnar nerve medially. Then you have got the radial nerve running in the posterior compartment of the upper limb. And then you also got the musculocutaneous nerve, which is a continuation of the lateral cord of brachial plexus. Also remember, some of the nerves like the long thoracic nerve to serratus anterior is already given directly by the roots of brachial plexus in the neck region. In the neck region, you also have dorsal scapular nerve supplying the scapular muscles given in the neck region. Directly from the roots? Yes, directly from the root of C5. So root of C5 is giving you dorsal scapular nerve directly in the neck region to supply scapular muscle. Yes, also directly from the roots of C5, 6, 7 come the long thoracic nerve to supply serratus anterior. And also remember, there is one nerve which is called as the suprascapular nerve, which is supplying again the scapular muscles, and it is coming from the upper trunk of brachial plexus. In the neck region, yes, it is also in the neck region. Upper trunk of brachial plexus giving you suprascapular nerve. So this was briefing, and the details come now. So what details? Let us draw a schematic diagram and discuss. So what are we discussing? You see, this is the roots and trunks. They will be in the neck region. And where will be the divisions? Divisions will go behind the clavicle. There are 6 divisions, 3 anterior and 3 posterior. And where are the cords and branches? Cords and terminal branches are in the axillar region. That will be in the axillar region. So you have to understand that it is the anterior primary ramus of the C5, 6, 7. It is going to be the anterior primary ramus of the root C5, 6, 7 in the neck region, contributing to the radial nerve. Radial nerve has all the 5 root values. If you say radial nerve has all the 5 root values, there is also the median nerve. Actually, understand that axillary nerve is a proximal nerve and will have proximal root value, which is C5, 6. And if you're talking about ulnar nerve, which is given distally, is having distal root value, which is C81. So usually it happens that distal root value will go to the distal nerve like ulnar nerve. But somehow all the 5 root values are coming to this nerve, which is radial nerve. And not only radial nerve, it is also the median nerve. Some books say that even median nerve has all the 5 root values. But my advice to you is, if a question comes, which nerve has 5 root values, the first answer should be radial nerve. And the next could be the median nerve. So radial nerve has all the 5 root values, even median. But if you have to really choose, radial is the first answer.